Dr. Brad Hannon here with another one of my MET Foundations of Health videos where I am teaching you how to move right, eat right, and think right. In this video, I will be discussing what you need to know about sugar. Bottom line here is that the average American consumes way too much sugar and their body cannot process and handle it, and at some point will begin to cause poor health problems like diabetes, neuropathy, poor vision, cardiovascular disease, and more. Common symptoms of sugar handling issues are dizziness, depression, inability to concentrate, craving sweets, sleepy, difficulty sleeping, waking up at night, nighttime urination, hands and feet numbness, double vision, blurred vision, extreme thirst, fatigue, weight gain, weight loss, mood changes, feeling stressed, headaches, and extreme hunger. When we eat sugar, both the quantity and the rate or speed at which the sugar hits our blood are factors in our ability to handle it appropriately. Sugar and carbohydrates, which turn into sugar, cause a spike in blood sugar, which causes our beta cells in our pancreas to release insulin, which basically finds sugar and takes sugar into our cells. Insulin is like a key necessary to allow sugar access into our cells. The problem begins when we consume sugar that hits faster than we have insulin to get the sugar out of the blood, or we consume more sugar than we can produce insulin to get the sugar out of the blood. Finally, at some point we can become what is called insulin resistance. Basically, our key quits working, resulting in more sugar in our blood. Common lab tests are blood glucose and hemoglobin A1C, which is when sugar attaches to our red blood cells. Sugar in our blood is bad as this causes inflammation and other serious health problems. Too much sugar in the blood is what we call diabetes. There are two main types of diabetes, type 1, and these are people who cannot produce insulin from birth or a very young age, and type 2, which is what we used to call adult onset until kids started getting diabetes. Now we are even beginning to coin a term called type 3 diabetes or diabetes of the brain. When we have too much sugar in our blood, our kidneys try to push it out into our urine, and our liver will produce triglycerides. These repetitive spikes of blood sugar are stressful to the body. Now on the other side of things, if we go too long between meals or are not consuming enough fat, we can get low blood sugar between meals and have problems with hypoglycemia. Understand that sugar feeds bad bacteria and cancer. It is actually one of the ways we detect cancers and their spread into other parts of the body. Whether it be diabetes, hypoglycemia, or any person in between, it is in our best interest to reduce sugar and high carb consumption to stabilize our blood sugar and reduce the highs and lows with poor blood sugar management. Try eliminating refined carbs, grains, dairy, high starches, fruit juice, alcohol, hydrogenated oils or fats, fake sugars, sugary drinks, cappuccinos, sodas, white flour, white rice, white potatoes, white bread, and pasta. Cinnamon is known to slow down the absorption of sugar, which can be helpful. One of my favorite herbs is genema, and keep in mind that people who consume a lot of carbs and sugar oftentimes are B vitamin deficient. So remember, when you want to feel your best, think MET. How are you moving? How are you eating? And how are you thinking? And this can steer you in the right direction to achieve a healthier you.